Welcome to another edition of Parenting with the VM Foundation. I'm your host, Nikita West, manager of the Victoria Mutual Foundation. With me today is Dr. Kathy Madden, OBGYN, and in this episode, we answer questions expectant and new parents may have of their safety and that of their child amidst COVID-19. Stay tuned for this important discussion. Welcome, Dr. Madden, and thank you for being here.
Thank you for having me.
Now, Dr. Madden, what are some of the range of emotions, fear that some of our parents may be experiencing at this time, both mommy and daddy?
In my practice, in both the hospital and in the private setting, it doesn't matter how composed you are as an individual, we are all affected by COVID-19.
Mm-hmm.
And so I have persons with the cool, calm, collected outward appearance, and then you have those who are freaking out about what's happening. So a lot of the questions I get are about how do they cope with preparing for the baby during the pandemic. I get asked how do they protect themselves and prepare for if they do get COVID-19 and what kind of impact it would have on the baby if they should have COVID-19. Those are most of the common questions I get.
And it's important that we address some of those questions. But before we do that, those emotions, those, fears, and, though we are appearing cool, calm, and collected on the outside, some of the anxiety that's internal, how could this be affecting the unborn child or the child, the newborn that's before us?
Unfortunately for us, in terms of local data, we don't have much information about how anxiety and stress interacts with the persona of the child and the outcome of the child when the child is born. But having that amount of stress and fear, it causes a sort of stress response for us, for all of us. And that stress response is elucidated by a change in our hormones. Those hormones can actually trigger things like preterm labor and preterm delivery. Also, when you're stressed, you're not able as when you're not stressed to fight infections and to be as healthy as you can be. So it really impacts your wellness and your well-being while you're pregnant. That in and of itself impacts the outcome of your pregnancy.
Wow. And it's so important that you touched on how that could affect the your immunity to fight COVID-19 or any other disease that there is. Considering that there may be additional stressors, what are some immune boosters that we could, pregnant moms could be using at this time? We all know that breast milk helps with protecting the baby. Is there anything during that period too that mothers can be taking to help protect themselves and the baby?
Well, the best advice that we can give, normally when you're pregnant, you are recommended to be taking prenatal vitamins.
Right.
So you have to ensure that you are actually taking these prenatals. Some people believe that, if they miss a week or so, they are fine. In most cases, you will be fine. But given COVID-19 in our environment now, it's best recommended that you stick to taking it every single day.
Right. We can't take any chances.
Right, because it actually has the nutrients and vitamins that help to boost your immunity on a regular basis. Some people will ask about taking extra vitamin C. I don't have a problem with that. 1,000 milligrams per day has not been shown to cause any ill effect for both mommy or baby. So there's no harm in taking that vitamin C. And otherwise, it's just about eating healthy. So a well-balanced diet. So your vitamins come from your fruits and vegetables mostly. So make sure that we have a nice balanced diet throughout the day. Unfortunately for us as Jamaicans, you tend to see a plate that is full of rice and peas, mostly, and a little scrunching of vegetables on the side.
So we have to
So we need to switch it around for our wellness, not just only because of COVID-19, but otherwise as well. So that's what I advise my patients and my mothers. And I ask the fathers to try to chip in and make sure that these fruits and vegetables are of, abundance in the household so that it's more attractive to the mother to eat those rather than the carbohydrates.
Absolutely. So some expectant mothers, of course, have visits to the gynecologist quite frequent, depending on where they are in their pregnancy. Are there persons or yourself who are considering or have facilitated virtual checkups? I know there is, some parents may have reasons to fear going in. Are we considering virtual check-ins?
Well, a lot of the hospitals have adjusted the regular intervals between checkups according to the risk of the patient. So if you are a low-risk mother, which means you don't have any illnesses, you've been completely fine most of your life, then we actually adjust the time intervals between visits to lessen the amount of times you have to come out and come to the clinic to be exposed potentially. So you will find that both the public clinics as well as the private doctors have adjusted the time schedule to stretch as much as possible an interval that keeps you away from a hospital setting or a private office setting. If you're a high-risk patient, which means you have a chronic illness, there's something happening with the pregnancy that requires more check-ins, then you may not be able to get that interval of lengthened. So that's one way that we deal with that.
What about home visits?
Well, you see, we have to consider that.
Yeah.
You are bringing a stranger into your house. We are doctors or nurses or midwives that may be exposed to patients. And so it may not be the best idea to have somebody coming into your household. And also for us, we have to be safe for ourselves too, because we have families and we have to take care of ourselves. So I don't think home visits are becoming, in vogue. A lot of us as well, we try to do phone calls and phone check-ins in between. And I do know that there are platforms for virtual checkups. It's just that the virtual checkups can only really give you a verbal sort of check-in in terms of measuring the mother's tummy or abdomen to make sure that she's growing appropriately, to listen to the baby's heartbeat. Those things can't be done in a virtual checkup. We can ask you questions like, are you feeling the baby move?
Yes.
You should check to see how much movements you have per day. But, there are other routine things that have to be done in person.
Understood.
So it's a little difficult in that sense.
And we are, of course, we are sure that all protocols are observed at these facilities.
So you sanitize probably 10, 20 times before you get seen. You're encouraged to wear your mask. And I must say that's a little pet peeve of mine, because a lot of patients believe that once they get into the doctor, they peel the mask off and they start talking. But, we are probably the worst persons to be peeling the mask off in front of. So you should keep your mask on and consider everybody positive for COVID-19 until proven otherwise. So keep your mask on, sanitize. If you are going to a public clinic, bring your own towel so that you can minimize the amount of exposure you have to the bed and the bed linen that maybe have been exposed to somebody else. And ensure that you practice good hand hygiene. The sanitizers are great, but if you do get the chance to actually wash your hands, that's actually better.
That's a better option. Wonderful. Usually when mothers are pregnant or, families are expecting, we tend to travel overseas to go and purchase items for the baby. Should pregnant women be traveling at this time?
I do not encourage it. I believe that if you can limit the amount of interaction you have with outside individuals, I believe you should minimize that amount of exposure. And an airport and an airplane is an environment that's, well open and well known to increase your risk of, inadvertent contamination. So I don't advise air travel at this time unless it's absolutely necessary.
Okay.
And if you do travel, your mask and sanitizing is key.
What are some guidelines or tips parents with newborns should observe at this time?
So particularly if you are a new parent, parenting is even harder without COVID-19
Right.
in place. So it's a lot of adjustment for the new parents. For those who actually have been parents before, it's an evolving situation because you have a newborn and young kids to care for sometimes. So what I usually advise is that you have to remember to practice your hand hygiene as much as possible, especially if you have a parent who has to work and come back in the evening. So your hand hygiene, and also remember to practice wearing your mask as much as possible outside and limiting contact with other individuals by social distancing as best as possible. With a newborn, everybody wants to see the baby.
Yes.
The grandparents, the aunts, everybody wants to come and visit the baby and bring their own little token and help you out so you can get a little sleep. But, you know, at this point in time, we have to recognize what's happening, and you have to limit the amount of visitors to the household. If you have somebody that's coming in like a nanny on a regular basis to help you out, then that person also has to be aware of their responsibility. And so they have to practice the safe hygiene and social distancing as much as possible. And they too have to be honest with you in terms of their exposure and how they feel on a daily basis. So it's always good to keep a check-in on the person who's coming to help you, to make sure that they are not ill and they don't come in and contaminate your environment. Apart from that, parenting requires a lot of planning. So we are at the phase of community spread. It's hard to social distance in every single situation sometimes. So you have to consider that if somebody gets infected, how are you going to set up your household so that you distance some persons from you and they have their own little environment in the house so that they don't mix with you and the baby. So it's always good to plan ahead, have an area that you can identify and set up quickly if that should happen. So if one thing I have to practice, because I work at a healthcare facility and I see patients every day, it doesn't matter because we're at the community spread phase. Once you come in, try to take a bath quickly and to change your clothes, your outside clothes and outside footwear, so that you don't carry that into the environment.
And before handling the baby.
Now, in some cases, mummies try every single thing and they still do end up with COVID-19. In that case, what has been recommended is that you should ensure that you wear a mask and you do your hand hygiene in terms of handling the baby as well. But breastfeeding can actually still continue. And in some cases, that may actually offer some amount of what we call passive immunity. That's why we say breast is always best. Because if you are fighting the infection, then your body would actually make antibodies to the infection. And we propose so far, because we don't have the true evidence, that you will pass on some of those antibodies in the breast milk. There's no evidence to show that the infection passes through breast milk. So we believe breastfeeding should still be safe, right? If you are very ill to the point where you're coughing and even the mask doesn't seem to be providing much effect, then you can pump. So express the breast milk and with good hand hygiene, and then you can ask someone else to feed the baby during that time.
Okay, yes, very important. Earlier you said that parents ask if you get COVID-19, you know, how does it impact the baby? I think this is an opportune time for us to discuss that. Is there enough information or research out there suggesting that this has an impact on the baby? And if so, how?
Well, unfortunately, you know, COVID-19 has really just been with us for about 6 months or so. So the data is evolving and the research is very limited. Thus far, we have not seen where there is any ill effect to the baby. So women ask, will my baby be born with any abnormalities or any handicaps because of COVID-19 if I had it during the first part of my pregnancy? So far, we are not sure, but we have not seen that happening in the first world countries that had been exposed before us. So I, at this point, would have to say we have no evidence to say that that is so. What we do note, however, is that once you have any form of an infection, Whether it's gastroenteritis and you're vomiting and have diarrhea, or you have a respiratory tract infection, which means a cough or a cold, then that increases your risk of going into preterm labor. Because as I said before, it sort of stimulates a stress response in the body. And the hormonal changes can cause you to start contracting and your cervix to start opening. So you essentially are in preterm labor. COVID-19 is no different from any others in the sort of stress response. It may actually cause a more exaggerated stress response. And so there is an increased risk of preterm delivery if you do have COVID-19. We also know that pregnant women, when they are exposed to significant illnesses, sometimes they're at increased risk of having a more severe reaction to that illness as compared to someone who is not pregnant. And so the guidelines that are out there state that pregnant women are considered very high risk with COVID-19 of having significant lung problems and requiring ventilation or ICU care. We have not seen that to this point. As a matter of fact, I was just discussing it with some colleagues, and a lot of the patients that we are seeing that are pregnant are thankfully asymptomatic. So we just have to take the necessary precautions for them. But the guidelines that exist say that the pregnant woman should be aware of the fact that they, as compared to someone else who's not pregnant, may require more intensive care.
Okay. And with COVID-19, there's a lot of things that we talk about in terms of protecting ourselves. Social distancing is one.
Right.
With all this distancing and how important support is during pregnancy or during when you have a newborn, are there any, or how can daddies support and families support the mother and the family in general during this time?
So, they commonly say it takes a village to raise a child.
Absolutely.
And that village needs to start coming around the mother from during the time of pregnancy. Unfortunately, with COVID-19 now, that kind of limits your interaction and your bonding with other persons in your family. Grandmas and grandpas have to stay away from you, and those persons were vital to helping you out, especially if you have other young ones as well. Social distancing actually impairs the amount of activity you can have with the grandparents and the other relatives. And more so for the older persons in your family, you have to be protective of them as well. So I usually state that encourage more virtual calls. We have WhatsApp and FaceTime now, so it's easier for us. Limit the amount of visits if they have to come, and ensure they wear their masks. For the fathers who actually live in, then they have to start to play a major role, because now you are likely the only person that mommy can actually come in contact with and feel safe. So that means your responsibility when you actually go out into the outside environment is even greater, because you have to protect yourself so that you don't bring something home to the mother. So ensure that you're wearing your mask and sanitizing and limiting the amount of exposure you have to other individuals, so that you don't actually, you're not the carrier into the home. In addition to that, because she has more need for emotional support from you, then you have to help around the house. You have to help with ensuring that she has what she needs, so she doesn't feel the need to have to go out unnecessarily. So the father's role becomes bigger now.
Wow. This has been quite insightful, Dr. Madden. Thank you so much for being here with us today.
Thank you. Thank you so much for having me.
Thank you so much for joining us for this edition of Parenting with the VM Foundation. Parents, if you need further assistance, the COVID-19 Parenting Helpline is available to you. The VM Foundation, National Parenting Support Commission, Fight for Peace International, and UNICEF have partnered to provide this support. Just click on the link included in this post to find the numbers. I am Nikita West. Stay safe and happy parenting.